Most of the young patients which I come across have these knee pains, and most common diagnosis we do is ACL tear. What is ACL? We'll know everything about ACL today in this video, and also what are the treatment options when you have an ACL tear. So let's see what actually is an ACL. See, this is your knee joint. As I've explained in my other videos, this is the upper bone, that is the femur bone, lower bone, tibia bone, and these two along with this patella, the kneecap, forms this knee joint. And this knee joint is made stable by two ligaments primarily. One, if you can see in the front, is the anterior cruciate ligament, the ACL. It's in the front, and one more ligament in the back called PCL, posterior cruciate ligament. So these two ligaments are the primary stabilizers of the knee. Other than that, we also have side ligaments which are medial collateral ligaments, lateral collateral ligaments. So all these four forms the ligaments of the knee joint. There are other minor ligaments also which are of not much significance, and in all the three, this ACL is the most common ligament to get injured. Now, what are the reasons, what are the causes for this ACL to tear? Is mostly it is the twisting injuries. The moment in a sport you have a twisting injury like kabaddi, cricket, rugby, there will be a sudden twisting injury or sudden push of this tibia, this lower bone in the front, causes the tear of the anterior cruciate ligament. Okay, it might be a partial tear wherein some fibers, because it has two fibers, one fiber might have got torn and one still intact, then it's partial tear, or a complete ACL tear. So what was the job of this ACL? Why did God give us ACL in the first place? Is to have this anterior stability. Without this ACL, my knee would have, in every moment, it have jerked anteriorly in the front, and there was no one to stop it. That's the job of the ACL ligament. So the most common question is, will this tear automatically heal? Whenever there is a cut in the skin, it automatically heals, but this ligament inside, it won't heal automatically. Even if it is partial or it is complete, it won't heal automatically. So we do reconstruction procedures in these type of patients. Now, how do I know that I have an ACL tear? So what will be the symptoms in this case? So main symptom will be the pain. The movement, in movements, extreme movements, there will be pain, and then instability. The moment you climb, or climb stairs or down, this knee starts like giving away. You feel that sensation of giving away, that this knee is not stable. The moment there is jerky anterior movement of the lower bone, and suddenly you feel that this leg is not stable enough, it has no control on your senses, that is when you know that you have an ACL tear. Then how do we diagnose it? The moment you come to us with these symptoms, we have certain examinations. We do how stable it is. We'll try to push the knee up and see how much joint flexibility is compared to the other knee, and we get an X-ray done to rule out first other coinciding fractures associated with that injury. If at all it's not there, then the gold standard is MRI. In the MRI, we know, is it a partial tear, it is a complete tear, whether the tear is along the attachment of the tibia or at the attachment of the femur. Ligament goes from here down from the lower bone and gets attached to the upper bone. So where exactly is the tear, we'll get to know. And again, if it is an acute tear, we'll try to repair it. If you come to us within a week or so, we'll try to repair it. And again, as I've told you, it won't heal by itself if you have symptoms. Does then all ACL surgeries require ACL tears require surgery? No. If you are old, like in your 55 60s, we don't do it. If you have a very low demanding lifestyle, you won't walk much, you are a sitting person and a very low demanding, not a sports person, and you don't complain of any pain or instability even after ACL tear, this can happen when you have a very good muscle bulk which is of good strength. This can happen. In those cases, we won't do a ACL surgery. So what do we do now? Then whenever there is an ACL tear completely, we do ACL reconstruction in chronic cases like more than 2 to 3 weeks. What we do is there will be extra ligaments which we take, these hamstring ligaments, or in the foot there is something called peroneus ligament. We take that ligament, we'll recreate the same position like in the tibia it is getting attached here, we'll make a tunnel at the same position, and at the femur in the same position where it was attached before we make a tunnel, and the extra graft which I have prepared will go through this tunnel and will be fixed in the same position as the ACL, and will be tightened in the same manner that it does the same job which ACL was doing before, that is keeping your knee stable and pain free. So this is how we do, and everything will be done arthroscopically. We are not going to open the joint and everything. Just with two tiny incision we'll put a camera and do all the work required for this. So this is how we treat the ACL surgeries, and the post rehabilitation is very important. Only isolated ACL surgeries without meniscus we keep 2 weeks rest and start mobilizing the patient. You will not be in bed rest, you will be moving in and around. It's just with a support or a walker you will be walking around from day one itself. It's not like you will be resting or bedridden or something like that. And after 2 weeks we'll mobilize your knee, will make you walk, and by 6 week you will be stair climbing, you will be doing everything. And these sports, going back to the sports, will restrict them for 3 months, and then they can go do all the activities possible. So it's a very tiny procedure, very limited procedure with a very less muscle handling, and recovery is faster. So this is all about ACL surgeries. Share among your friends who have ACL surgeries, who have undergone ACL reconstruction, and comment ACL, or let us know what extra or any information about any orthopedic procedures you want to know. We'll make a video next on that. Please like, share and comment on this video. Thank you.